This is Robert Weinstock, MD, along with Caroline Watson, MD, and we're going to be talking about this segment of bimanual cataract surgery instrumentation sponsored by MST. And in this session today, we're going to be talking about cortical cleanup, bimanual wound assist IOL implantation, viscoelastic removal, and wound hydration at the end of the case. So for this part, again, we're going to be using the same 19 gauge irrigating chopper that you saw previously in our videos in the earlier parts of the procedure, and that again is the MST instrumentation 19 gauge to match our 1.4 to 1.6 diamond incisions that we make. That'll be in the left hand to provide irrigation, and on the right side will be the MST instrumentation with the 19 gauge aspiration polish IA tip. This is the Maestro Barrett capsule tip. It's got a little bit of a diamond dusted tip for polishing the capsule. It has a 0.4 opening. Many people like 0.3 openings at the tip. We prefer 0.4. It allows for a little faster, more efficient cortical cleanup, and if there's a little piece of nucleus, it can be even used to remove those small little fragments, and you can use your second instrument to chop little thicker pieces into that. Or if there is an epinuclear shell, it will be evacuated faster and more efficiently. And this is the setup of these instruments with the handpiece and the tips that screw into them. The blue is always the irrigation side, and the yellow is the aspiration side. So you see we leave the irrigating chopper in the eye, much like we did during the phaco part of the procedure, and we use it in the anterior chamber to create stability, while the second instrument, or the right hand with the aspiration tip, is placed into the capsule under the edge of the capsulorhexis or capsulotomy, and is used to remove the cortex. Now, this can be done quickly and aggressively because there is no irrigation being forced down in different directions into the capsular bag like there is in coaxial techniques where there's a lot of chaotic fluid movement. There's a lot more stable chamber dynamics here in this situation. And if there's areas subincisionally, we simply remove the two instruments and switch hands to gain access. So here the right hand is the irrigation side now, and through the similarly matched wounds, we put the aspiration piece, and we have much better access to the subincisional area, and this can be done, not often, but sometimes you have to do this technique where you reverse it to try to get this sticky cortex out. Usually you can just leave it in its primary position with the irrigation on the left side and the aspiration on the right. It's not uncommon with real sticky cortex for us to go ahead and put viscoelastic in, push that cortex off of the posterior capsule and out of the visual axis, put the IOL in, which acts as a scaffold, and then we have a much safer platform in which to remove the remaining sticky cortex. What we like to do for our standard cases here is use the irrigating chopper without irrigation just to hold the eye still for countertraction, and this is the Bausch & Lomb micro-incisional implant, the Acryos mixed lens, which is an incredible hydrophilic acrylic lens that can actually be injected with a wound-assisted technique through this 1.5 millimeter incision. And once it's injected, then we come back with our aspiration tip. We begin irrigating to flush out the viscoelastic, remove any residual cortex, and deepen up the eye and position the lens, which is usually in pretty good position. Once that is done, we remove both instruments from the eye, which honestly, this is the first time in the whole case that the eye actually collapses a little bit because we've maintained irrigation throughout the whole case. We simply hydrate the wounds with a little BSS on each side of the wound and in the middle, and these small, almost paracentesis style wounds just seal extremely quickly. And obviously they don't induce much astigmatism or provide any significant risk of dry eye or infection because they are such small wounds. The Acryos mixed lens centers very well, and it's very nice to be able to do cataract surgery from start to finish, including lens implantation through such small incisions. Here's just some specs on that implant we use that you can take a look at its design. It's very unique. It's extremely stable lens. It vaults posteriorly inside the capsule, and we use it. It's our number one performing lens in our practice. So this concludes our segment on irrigation and aspiration, and highlights some of the MST technology with the curved INA 0.4 opening 19 gauge capsular polisher and the Nagahara 19 gauge irrigating chopper, which you've seen throughout these video series, and of course the Bausch & Lomb Acryos mixed lens, which is the lens, the only lens in the United States that's able to be injected through such a small incision. monofocal, zero-induced spherical aberration, high-performing optic for either distance or near vision, depending on the targeting for the patient. Again, this is Dr. Rob Weinstock and Caroline Watson, MD, and this has been sponsored by Microsurgical Technologies. Thank you.